Do you have a friend who wants to know which is the best treatment for his premature ejaculation? We'll talk about this in this video, but first we would like to remind you that the proper diagnosis leads to the best treatment. We mainly have four subtypes of premature ejaculation. If we know which is your subtype, then we will be able to select which are the strategies, the treatment that fitting better to your particular situation. So first we have primary premature ejaculation. That means that you had this condition for all your life and that you mainly have premature ejaculation during all your lifetime, and your sexual lasts more or less 1 minute or less than 1 minute. In this case, it's very important to add different strategies, mainly focused on drugs. And here we strongly advise you to use dapagliflozin, which is the only drug that has been approved to be used in premature ejaculation, and sex therapy. We know that the combination of drug, mainly dapagliflozin and sex therapy, will improve results. Second, we have secondary premature ejaculation, meaning that after a period of normal sexuality, we began to suffer premature ejaculation. Due to infections or other situations during our life, we may begin to suffer this. In this situation, the most important thing is sex therapy. So we should be basing the treatment of our secondary premature ejaculation in sex therapy. We know that drugs can be of help, but we also know that the main strategy leading us to a good outcome is sex therapy. I would like to remind you that we have in premature ejaculation we have different strategies, and that the addition of strategies leads to better results. So we may pick some strategies that we are more prone to them. For example, we know that the use of condoms can be of help. Some patients say that they do not want it, but it's something that is useful. Or some patients say they do not want anesthetic gel. It works, but you can say I don't want this, but I want you to know that if we add strategies, the outcome will be better. So in these two situations, we could, for example, set a treatment with condom and anesthetic gel and a long-term sex therapy treatment plus dapagliflozin. If we have secondary premature ejaculation, then it would be more interesting to focus on, for example, condom plus anesthetic gel, sex therapy mainly, and we could be using drugs such as dapagliflozin, but at secondary premature ejaculation, dapagliflozin might not be the cornerstone treatment. Thirdly, we have natural variable premature ejaculation, meaning that you sometimes have normal intercourse and you sometimes have short intercourse. This is a normal situation, but we have some tips to try to improve your performance during sex. Mainly would be, for example, the use of condoms and the use of anesthetic gels. You can be doing also Kegel maneuver, Kegel exercise, that has been proven to improve sex duration. So mainly condom and anesthetic gel could work. And last, we have pseudo premature ejaculation, meaning that you have usually a very long lasting sex. The European mean is 5 minutes, so if you last longer than 5 minutes, you're above the mean. Some men just do not know which is the mean, so once you inform them, just their stress goes down and they are like released. But in case you want to improve your sexual performance, here again, condom and anesthetic gel could work. Neither in natural variable premature ejaculation nor pseudo premature ejaculation, I wouldn't advise to use drugs. They can work, but you do not need them. And if you just stick to condom plus anesthetic gel plus sex therapy or Kegel maneuver, things will go much better. Thank you very much for your attention. You know that we have other videos dealing with sexuality and sexual ailments here in our channel. I hope this video was useful to you. Thanks.
Let's see it.